Dr. Marie Donna here, youth and adult psychiatrist here to discuss all things mental health and wellness related. Today I'm going to discuss the general side effects of SSRIs or selective serotonin reuptake inhibitors. So I'm just doing this video just because it's something I'm asked about quite frequently, and SSRIs are among the most common psychiatric medicines that I will prescribe. So honestly, SSRIs are generally well tolerated by most people and patients that I will prescribe them to, but like all medications, they can have side effects or affect people differently. So here's an overview of common and less common side effects of SSRIs. So the most common side effects that SSRIs will typically have will be among gastrointestinal issues, such as nausea. So often, usually when starting the medications, this might occur, but I will usually tell people that it usually will subside within a few days, 2 weeks of starting the medicines. And I will also tell them to take the medication with some food that can potentially often offset the side effect of the nausea or stomach upset with these medicines. Diarrhea is also sometimes a side effect that people might have with these medicines, or loose stools, especially with sertraline. So these would be things to keep in mind if this is something that occurs. But usually this does typically go away within the first few days of starting the medicines as well. Sexual dysfunction is another side effect that SSRIs can have, such as reduced libido, decreased interest in sex is common, or anorgasmia, like difficulty achieving orgasm or delayed ejaculation, and erectile dysfunction, such as some men might experience some difficulty with maintaining an erection. So if sexual side effects are occurring, these are things to keep in mind and to talk about with your medical provider if it's becoming a major issue for yourself or within your relationship. Weight changes are another thing that might happen with SSRIs. So sometimes weight gain might happen, and this one is most common with paroxetine or Paxil, but this can occur with other SSRIs over time. So this happens with Paxil specifically because it does work on more histaminergic action within the body, but SSRIs can also increase weight gain. But the reason that I will see it oftentimes in my patient is that sometimes depression or anxiety might actually cause someone to feel so anxious that they can't keep a meal down, or so depressed that they can't get themselves to make food. So when they start feeling better, they might be able to keep food down or want to be engaged with making food. So this is where weight gain might actually occur. Weight loss can occur with these medicines as well. And some people, especially those taking fluoxetine because it's the most activating SSRI, might lose weight initially. Sleep disturbances can happen with the SSRIs as well. Insomnia, especially with more activating SSRIs like fluoxetine, would be things to keep in mind. So I will always check in with people to see how their sleep has been affected. Drowsiness is another side effect, especially with the more sedating SSRIs like paroxetine, which can cause fatigue or sleepiness. SSRIs can also potentially cause vivid dreams. So this would be something to keep in mind when taking these medicines as well. Headache is another side effect that can happen, and it is common in the initial weeks, but usually it improves as the body adjusts to this medicine. Dry mouth is another potential side effect that can be bothersome, but is generally manageable with good hydration and other lifestyle interventions, but this can go away as well too. Dizziness is another side effect that can occur with SSRIs, and especially when you're standing up too quickly or if the doses increase too rapidly. So that would be something to keep in mind, but usually if good hydration and good dosing, this is something that I honestly don't see too often within my patients. Less common side effects, but things to take note of, are emotional blunting. Some people might feel emotionally numb or less responsive to both positive and negative experiences. So this would be something to keep in mind when taking your medications. But I would say if this is something that's occurring when taking this medicine, to talk with your psychiatrist or your doctor about it, because you want to make sure that you're on a dose that's good enough for you to help you with the symptoms that you're trying to manage, like depression or anxiety, but also be able to experience the full range of emotions if this is problematic for you. Bruxism, or teeth grinding or jaw clenching, particularly at night, can happen with these medicines as well. So if you already have a history of TMJ or teeth grinding or clenching and it's getting worse, this would be something to discuss with your doctor. Hyponatremia or low sodium levels is also something that can happen with SSRIs, but this is more common in older adults and those taking diuretics. So this can lead to differences in electrolytes and some dizziness. So this would be something to watch out for if you're taking an SSRI. Changes in mood, such as increased anxiety or agitation. Some people might experience increased anxiety or agitation, especially when starting treatment or increasing the dose, but sometimes these will go away when the body gets adjusted to the medicine. So just something to keep in mind when taking these medicines specifically. And serotonin syndrome. Serotonin syndrome is a rare but serious condition that can occur if serotonin levels become too high, often due to interactions with other medications that are usually involved with serotonin. Symptoms can include confusion, rapid heart rate, high blood pressure, dilated pupils, and muscle rigidity. Muscle rigidity is the big thing to look out for if you're having serotonin syndrome. And again, this is very rare, but it's something that you would need to get checked out from an emergency standpoint. And this would typically be when someone is taking a high dose of an SSRI along with another medication that can actually increase serotonin levels or actually is working on serotonin itself specifically. Something else to take in mind is if you are actually having withdrawal from the medicine. So this is something that when someone decides to taper off and say they're on a higher dose and stop taking it abruptly, discontinuation syndrome is something that can occur. So this is why if someone is wanting to taper off a medication, I will usually tell them to check in with me first so that we can do it in the most appropriate way. Symptoms of discontinuation syndrome can include dizziness, nausea, or flu-like symptoms, insomnia, and irritability. It's more common in SSRIs with shorter half-lives like paroxetine, but it can occur with all of them. So if you are deciding to stop your medicine, I would always suggest to check in with your doctor to do so in a well-controlled manner to avoid the discontinuation syndrome. As for long-term effects, there is some evidence suggesting that long-term use of SSRIs may be associated with decreased bone density, especially in older adults. So that would be something to keep in mind. And also weight gain, continued weight gain can be a concern for some people with long-term use. So if you're noticing that you're gaining weight consistently on these medicines, especially Paxil or paroxetine, which is the most common SSRI to cause weight gain, that would be something to keep in mind if there have been no other changes in your life. To manage the side effects, it can be simple as adjusting the time of the day you're taking the medication to help offset some of the side effects, making adjustments with the dosage, or sometimes a lower dose can reduce the side effects while still providing some benefits. And, also knowing too that if the side effects or whatever you're experiencing are unmanageable or intolerable, you can always talk with your doctor or your psychiatrist who might suggest switching to a different SSRI or another class of antidepressants. Always discuss any side effects with your doctor or psychiatrist. They can help you manage them or adjust your treatment plan if needed. Again, I am a medical doctor and a psychiatrist, but I'm not your doctor. So for any concerns regarding your medicines or medicines you're interested in taking, I would reach out to your medical provider specifically. But if you are wanting to seek help from a psychiatrist, I am located in Florida, but able to see patients virtually in Florida, Pennsylvania, New York, and Washington, D.C. And if you feel like this information was helpful and wanted to get more information, you can always reach out to our clinic. Thank you and have a great rest of your day.